moving on to a controversial change in health policy that could make a COVID-19 booster shot harder to get this year. Here's what's happening. The FDA said yesterday it will start limiting the updated vaccine to people 65 and older or people at high risk of serious illness if infected. So what could that mean for you? CBS News medical contributor Dr. Celine Gounder is here to break it all down. She is, of course, also editor-at-large for public health at KFF. Dr. Gounder, good morning. So what does this change entail?
So this really has to do with how the FDA would be approving updated boosters. You know, for the last few years, we've had updated boosters every fall. They are changing the framework for those approvals. So essentially, if you're 65 and older or have a chronic underlying medical condition that puts you at higher risk, and that does include women who are pregnant or recently pregnant, for those people, they will continue to do updates of the booster as the virus mutates and changes. And the approvals will be based on antibody data. So that's pretty straightforward. What is changing, though, for people under 65 is based on that new framework for approvals. It's very unlikely people under 65 who are healthy will continue to have access to updated boosters.
They won't even be able to get the booster, even if they want it, even if they will pay for it out of pocket.
Yeah, this is the issue, is that unless you falsify your risk factors, you would not have access if you're under 65 and healthy. And so, you know, we had heard Secretary Kennedy say, we're not going to take away your vaccines, we're going to be super transparent. And in fact, what is happening is people are going to lose access to vaccines.
So is this a money-saving move from the administration, or is it something else?
Well, they haven't been entirely transparent. It's not a money-saving move, to be clear. But normally, when you have a big change like this, you would have this be open to public conversation. You would be having external advisors advising the FDA. Those meetings would be public. You know, if many of you may remember when the vaccines were approved by the FDA before and recommended by the CDC, all of that was on YouTube. You could watch it live. The data was shared.
Well, so is this data-based? Do they just don't think it's necessary anymore?
Well,
we don't know.
So I think it's a matter of opinion, and this is the way it was issued was a 2.5-page policy opinion piece in the New England Journal of Medicine. There was not a big review of the data that accompanied that. That also would have been more typical.
Okay.
So this is an unusual move, which is why it's controversial.
It's an opinion. All right, Dr. Gounder, thank you very much. Appreciate it.